Hello everybody. Today for my presentation, I'll be talking about craniosacral therapy, which is a modality often disagreed upon when it comes to its benefits as well as the legitimacy of its assessment and diagnostic abilities, as the studies don't seem to produce very consistent results. However, in despite of that, it continues to be a therapy sought after and provided for the treatment of various ailments, including but not limited to fibromyalgia, migraine headaches, temporomandibular joint disorder, chronic fatigue, autism, coordination impairments, muscular pain, depression, and post-traumatic stress disorder. Some others said reasons to be a fan of craniosacral therapy is that it may be beneficial to one's self-esteem and general contentment with life. This alternative form of therapy relates to massage in that it is a mode of body work designed to induce healing by means of touch, the practitioner's hands being the primary tool used in treating their client. The average session is about 45 to 60 minutes in duration. The type of setting that this would likely be in is a massage, chiropractic, or osteopathy clinic and may be performed by a registered craniosacral therapist. On that note, I'll segue into the origins of craniosacral therapy. The first known research was done in the 40s by osteopath William Sutherland, though only gained notoriety years later when osteopath John Upledger lended a more scientific exposition. As for how the therapy is performed and what results, it is postulated that because of the slight amount of movement permitted by the synarthritic sutures of the skull, or I should say synarthrotic sutures of the skull, this allows for manual manipulation of the cranial joints, resulting in an increase in the circulation of cerebrospinal fluid. It is said that there exists a cranial wave or rhythm caused by the flow of cerebrospinal fluid throughout the cranium and spinal cord, branching out even to the limbs, causing a ripple effect that results in subtle lateral rotation of the limbs. Cranial flexion and extension manifest as the lateral bones of the head expand out, which is flexion. Meanwhile, the anterior and posterior relax in extension, after which the opposite occurs, and this cycle repeats approximately 6 to 10 or 12 times per minute. It is hypothesized that the subtle changes in connective tissue and the pulsing of CSF can be detected by the therapists, especially those with excellent palpation skills. The gentle and slow maneuvering of bones of the head, sacrum, and other regions facilitates not only deep relaxation, but also the destagnation of cerebrospinal fluid, or CSF. It was believed by John Upledger that this modality has a spiritual aspect and is not solely physiological, but meditative and intuitive. Dr. Upledger is quoted as saying, "There is no need for a client to tell me verbally what is wrong," and "the inner wisdom which knows what is wrong, why it's wrong, and how to correct it. The body tells the therapist what needs to be done." A quintessential craniosacral technique involves letting the weight of the head create the pressure as the therapist's fingertips rest in the space where the neck and occiput meet, and holding until the tissue releases. Some contraindications include brainstem tumor, cranial fracture, cerebral swelling, aneurysm, and blood clots. This modality is also good for those who practice it, as it's a more delicate and laid-back form of massage that won't quickly lead the therapist to burnout or sustaining overuse injuries.